Hello everyone, I am Suparna Shri and you're watching Jagran English. As the eye flu cases are increasing in our nation, there are different questions that are arising in everyone's mind. It is very important to get right answers of all those questions and stop the spread of these virus. For that, we have Dr. Aparna Darswal, HOD Ophthalmology at Metro Hospital, Faridabad. Welcome, Dr. Aparna.
Thank you very much. Thank you for having me. Good afternoon, everyone.
So first of all, our audience would like to know how this virus is spread.
So right now, a lot of cases are there in our community and it is spreading very fast. So the first reason is the hot and humid weather. So the weather is responsible for this increasing number of cases because the bacteria and the viruses, this weather is favorable for their multiplication, for their thriving. So it's more common in this weather, and plus the contaminated water is not helping. So it is spreading from one person to another. So that's how it's spreading.
And what are the symptoms of the eye flu?
So the symptoms of the eye flu vary depending upon the severity of the disease you have. So in very mild cases, you'll just have a little redness and irritation in your eye. That's why it's called pink eye. And as the infection increases, it can cause discharge, it can cause pain, it can cause burning, and it can cause watering, stickiness of your eye. So it totally depends upon the amount of severity of the infection you have.
So there are a lot of cases coming in this time in which patients with eye flu have fever too. So why is this?
It happens with some strains of the viruses which are able to cause a throat infection. Also eye infection, adenovirus mostly. So it's called a pharyngoconjunctival fever, where your throat is involved, your eyes are involved, and you get fever because of the virus. So.
Okay, so there is also a lot of myth out there. People think that once we look into an eye of someone who is infected by the eye flu virus, so they'll also get eye flu. So is it true?
Very common. Yeah, you're right. It's a very common myth. Even today, even these days when we are getting patients and their family members, they keep wearing those glasses and they think that looking at the other person who has flu will give them flu, which is a myth. It is not true because it spreads by contact. So when you touch your eyes get contaminated with those germs, viruses or bacteria, whatever it is. Then you touch the surfaces and from there it spreads to other people. So it's very important to maintain hand hygiene to prevent the spread. You need to wash your hands with soap and water or with sanitizer whenever you touch your eyes. If you have the flu, and if anyone else has flu and you touch that person, you shake hands or you go near that person or touch that person in some way, then you need to clean your hands. Hand hygiene is something which is going to help you prevent the spread of this disease, not looking at each other. So it's better to stick to our tradition and do a namaste. Do not do a handshakes and do not hug people these days when there is this virus in the air.
So to what extent is this eye flu virus harmful?
See, viral conjunctivitis is sometimes more harmful than the bacterial one because it can enter the cornea and then it can cause keratitis, which is a serious condition. It can also affect your eyesight. So it's very important that if you have the eye flu, you do not self-medicate. It is not totally necessary that if one person is responding to one eye drop, you will also respond to that eye drop and that eye drop is good for you too. So it's very important to consult an ophthalmologist to check for the symptoms, how severe it is, what eye drops you need. So it can be harmful, it can lead to other complications. So it is very important to be in good care.
Yeah. So when we talk about going to the doctor or an eye specialist, there are a lot of people who don't visit a doctor. They just go to the pharmacist and they ask for medicines and they get well in few days. So is it okay?
See, unfortunately, this practice is very common in India yet. People don't need to go to hospitals or pay the fee of the doctor. They just go to the chemist and take the eye drops directly. So if it is a simple bacterial or it totally depends on chance then. So if it is the eye drops suit them, that's fine, they get well. But I have also seen many cases getting complicated because of the wrong eye drops being given by the chemist. So it can be very dangerous practice also, especially when it's involving your eyes and it can affect your eyesight. So it's totally not recommended to take eye drops from a pharmacist or a chemist.
Okay. So, what are the reasons behind the rising cases of the eye flu? Because eye flu is common in the monsoon season, but this time the eye flu cases are rising a lot.
Yeah, the monsoon is a little extended. It started early and it is going on. So it is because of that, the humid conditions are just continuing for a long period of time, which I told you earlier, it is conducive or favorable for the multiplication of germs. So these conditions together are making it worse. There is water logging, and that's a big problem in our country right now. So the contaminated water is also not helping. It's causing the disease to spread more.
Okay. So, according to AIMS, this flu is spread by house flies. What's your take on this?
It is possible for the viruses to be spread by houseflies because they sit on surfaces and then they sit on people. So if you have, more germs in the air on the surfaces, then they will help in spreading the disease more. Okay, they cannot be the only factor it is spreading. So it cannot only be transmitted by houseflies. It is not that kind of a virus. It is simple adenovirus. It can spread by contact. So maybe that is helping because again, the number of flies are more in monsoon. They can help the spread, but they cannot exclusively spread the disease.
There are a lot of cases in which young children are getting this eye flu. What is the reason behind that?
Because children do not maintain hand hygiene and keep touching their face, rubbing their eyes, and because they are always in a crowded place like a school, so it spreads really quickly in kids. I have seen. I had a few teachers as conjunctivitis patients, and they were telling me that almost 100 kids in a school in one day they got conjunctivitis. So it's again a confined space, crowded areas, and touching each other, touching your face. Of course, these things will increase the spread in kids.
Okay, thank you so much. This was very insightful, and I know our audience are going to get enlightened by this. They'll know what precautions they should take to stop the spread of the eye flu. Thank you so much.
Thank you so much for having me. I hope this information helps people and we are able to control this in the coming days. So that